Good afternoon, and welcome to today's virtual conference on Los Angeles County Sheriff's Department jails, hosted by the Civilian Oversight Commission. My name is Danielle Butler Vappie, and I'm the Interim Executive Director of the Commission. Today, we're discussing transitional services for people leaving jail, including connection to services for housing, food, health coverage, transportation, and job opportunities. This is the third session in a series of conferences about the Sheriff's Department jails. We have one remaining session that will focus on reducing recidivism that will be held on June 12th. I would also like to highlight that we have one vacant commissioner member position. If you or someone you know would be interested and available to serve in the commission, please visit our website at coc.lacounty.gov to review the bulletin and application. For today, we have a great panel of speakers lined up to discuss transitioning out of jail. You'll hear from Vanessa Martin, who's the Reentry Division Director for the newly formed LA County Justice Care and Opportunities Department, followed by the Department of Public Social Services Division Chief, Sherry Cheatham, and from Dr. Jennifer Hunt, who's the Acting Senior Deputy Director of the Department of Mental Health's Reentry Services Division. And lastly, we'll hear from Los Angeles County Sheriff's Department Lieutenant Joe, sorry about this, Joe, if I butcher this, Cavabias, who leads the Community Transition Unit. Your moderator will be Commissioner Luis Garcia, who serves on the Commission's Conditions of Confinement Ad Hoc Committee. Thank you all for joining today. And now I'll turn it over to our moderator, Commissioner Garcia. Thank you.
Thank you, Danielle, and thank you, everyone. Good afternoon for joining us to learn about transitional services to assist incarcerated people with their reintroduction into the community, including assistance with housing, food, health, coverage, transportation, and job training opportunities. My name is Luis S. Garcia. Some of you may remember me from the first two conferences on the Sheriff's Department jails. But for those of you who I have not yet met, I'm a member of the Civilian Oversight Commission, and I work for Advocates for Human Potential, a behavioral health research and consulting firm where I'm a senior program manager working closely with county governments, nonprofit agencies, and private sector organizations to improve California's behavioral health system infrastructure. I also volunteer as an associate clinical social worker where I specialize in working with people with mild to moderate mental illness. In the first two sessions, I provided a lot of insight into my experiences with mental health and substance abuse that contributed to my time in the carceral system. So I won't revisit that today, but rather I'll share what happened in my last transition back to the community. I was fortunate to have a place to stay through family support. Returning to my local community college, I was able to land a job as an academic tutor until I transferred to my undergraduate university, where I then landed a work study position. During this time, I was paying for my private healthcare insurance. In grad school, I was covered through the university. In both of these higher education settings, I accessed career and professional development services that further aided my launch into the workforce. In short, my higher education experiences were in essence my transition supports. Extensive research has documented that as compared to the general population, people exiting jails have chronic health, mental health, behavioral health needs, and are more likely to be unemployed and face challenges securing housing in their transition into the community. Within this context, I would also like to focus on one of my professional experiences as it relates to people exiting the Los Angeles County Jail. When I worked in Skid Row as a senior director of programs and services, one of the programs I oversaw was a 155-bed Los Angeles County Department of Health Services Housing for Health Stabilization Program. At one time, we had Office of Diversion and Reentry program beds, but then some county staff wanted them moved out of Skid Row. Then all the beds turned to the Housing for Health beds with a mix of what was then called whole person care beds. These participants came out of the jail and were connected to local community-based organizations such as Project 180 or Health Rate 360. I also oversaw a 30-bed Department of Mental Health interim housing program, as well as loss of funded interim housing programs And what was interesting, it was the majority of the people in these programs had some level of justice system involvement. In fact, all of these programs, including the 2 state prison reentry programs and 1 county AB 109 program, housing program, intersected with the Department of Mental Health and Department of Healthcare Services because many of these participants were under mental health outpatient or healthcare services systems of care. During this time, I witnessed a real bureaucratic maze. For example, once a person got out of jail and entered any one of our programs, case management staff assisted to connect them with the Department of Public Social Services to qualify for general relief and other services such as the reestablishment of their Medi-Cal coverage. Oftentimes, they were simultaneously working to obtain a California's driver's license or identification card from DMV or a Social Security card from the Social Security office. All the while, we were trying to keep them engaged in outpatient medical and mental health services. Some would also be connected into job training programs in the area, or in some cases, they would be able to complete their credits to earn their high school diploma in the community with some partnerships that we had. With all the time spent in jail, many of these areas should be taken care of, or at least planned in advance to assist people in their transition and reduce the likelihood that they will return to custody. The significant challenges faced by those leaving the county jail system underscores the importance of collaboration to link individuals with services both while in the jail and as they return to the community. So today we continue the conversation on jails with a focus on efforts to ensure that people who are exiting jail are provided with a coordinated community reentry process to connect them to services they need. As the Commission continues to evaluate the jail conditions, we welcome continued community feedback. After the speakers provide their expertise, there will be an opportunity for the community to ask questions. In addition, written public comments regarding the jails can be submitted online. Please visit our website at coc.lacounty.gov for instructions. The deadline to submit written public comment is 5 p.m. tomorrow, June 1st. And now, turning it over to today's speakers. Although we've told you the names and titles of the panel speakers, I invite each of you to introduce yourself, including your preferred pronouns, and a little bit about your background, if you wish. Without further ado, I will turn it over to our first speaker, Vanessa Martin, who is the Reentry Division Director at Los Angeles County's newly formed Justice Care and Opportunities Department. Please go ahead, Vanessa.
Thank you so much, Mr. Garcia. And thank you so much for the Commission for inviting me to participate and present to all of you today. It's very much an honor and a privilege to be here. I'm very excited to talk about some of the programs that we have designed and implemented and manage in the Reentry Division of the Justice Care and Opportunities Department. Just a few words about myself. I've been in this work for 25 years, dating myself way back to 1998, working on alternatives to incarceration in New York City. I have been here with my partner and our 2 children in Los Angeles for the past 10 years, and have started working with the county about 5.5 years ago, building the reentry services for LA County, starting under the Office of Diversion and Reentry at DHS. So very grateful to have been able to design and incubate a lot of the programs that we currently have, and a couple that I will be talking about today under DHS, and really excited about the opportunity to continue to sustain and expand them under the newly formed Justice Care and Opportunities Department. Okay, next slide, please. So today, in response to some of the issues and this current panel is focused on, things like housing, food, transportation, jobs, I've decided to focus on 2 of our reentry programs. We actually have several other reentry programs within our portfolio, but I'm focusing on 2 for today. The first one is the Reentry Intensive Case Management Services Program. So just a brief overview. I won't read you all the slides. Hopefully everyone can see everything on the slides. But the Reentry Intensive Case Management Services Program, RICMS for short, mouthful, provides case management and service navigation to people with prior criminal legal system involvement. And so what the beauty of the RICMS program is that it uses community health workers who are credible messengers, peer navigators, peer, these are all interchangeable terms that many of you may have already heard. And they act as real advocates and mentors and case managers to their clients. The beauty of this model, again, is in the use of the CHWs, not only in being able to provide the care for and the support to the clients, but this program has really become quite a large employment program for people with lived experience of incarceration. We started out the program in April of 2018 with 12 community-based organizations across the county, and we have doubled in size to over 25 community-based organizations across the county. We have coverage in the entire county as far as Lancaster to Long Beach and everything in between. And really the beauty of it is working directly with community-based providers who implement the program. These are organizations that have long-standing reputations in their communities and have been doing this work for decades. The funding for the program is through state legislation, Prop 47, many people are familiar with, Senate Bill 678 for those on active adult felony probation, Assembly Bill 109, which is those on post-release community supervision, as well as federal funding through the American Rescue Plan Act. And we've really actively pursued diverse and varied funding streams in order to have a program that what we consider universally accessible, meaning there's no wrong door. We can serve anyone with criminal justice involvement through the program. Since its inception, just had our 5-year anniversary of the program. We have served 27,000 clients, and actually about 40% of our clients are pre-trial. So these are people who, are coming out of the jails, the LA County jails, and were awaiting trial. And our goal is to really expand the program to serve the pretrial public, to serve people coming through the court system, working collaboratively with the courts, as well as the public defender and the district attorney, to try to have some conditional releases of people leaving the courts to catch them before they're released through the jails. Our program goals are to reduce the rate of recidivism as our primary goal, and improve public safety in LA County, and to improve health, both physical and mental health and substance use disorder service use of justice-involved individuals in LA County. Our outcomes are improved health and well-being, reduced arrests, reduced convictions, reduced incarceration admissions, and reduced incarceration days. Next slide, please. So there's a lot on this slide. I won't read it all, but just to highlight some of the program services. Again, this is a service navigation program, right? So the idea is that the community health worker links individuals to services and resources in the community and helps to advocate for them and support them in the delivery and completion of these services. The real goal is to leverage services, and resources that are already available, like substance use services through DPH, substance use and prevention and control, through DMH, Department of mental health services, and a variety of different services that LA County has to offer, as well as other community-based organizations and their networks. So as we see here, there's assistance with benefits, including, a lot of different benefits, CalFresh, General Relief, countywide benefits entitlement services. We link people to housing, employment, education, legal assistance, transportation, food, through food banks and gift cards to grocery stores. The top 3 needs that we're consistently hearing, not just through this program, but all of our participants across all of our programs, are housing, employment, and legal services, with substance use and mental health being kind of the 4th and 5th highest needs. Eligibility for the program, we are serving adults, so in our definition, that's age 18 and over, just had to be arrested, charged, or convicted with a criminal offense, and you have mild to moderate mental health and or substance use disorder. On average, the duration of the program is about 7.5 months, and that varies, but that's the average, but participants can receive services for up to 1 year if needed. Next slide, please. So our referral sources for the program are through the Care Transitions Unit pre-release program in the county jails. That's housed under the Correctional Health Services Division at the Department of Health Services. So how that works is that The medical caseworkers in the jail assess clients while they're in jail pre-release, and then there is an immediate warm handoff to our RICMS post-release, our community-based organizations for those clients. So the idea is to have this kind of seamless transfer back when they are reintegrating it back into the community. We also work very closely with the LA County Probation Department, the California Department of Correction and Rehabilitation, a few city jails, and other various community referrals that our community-based organizations conduct for us. And next slide, please. Our program stats, as I mentioned earlier, we have served about 27,000 clients to date. Our current program capacity is a little bit over 2,500. So at any given time, we can be serving 2,500 clients. We have 85 community health workers, again, across the entire county, and currently 25 community-based organizations. Next slide. So the next program I'm going to talk about is the sector program. This is a job in a sector-based employment and training program. So this addresses one of the other factors and the issues that the panel was interested in hearing about today. So the program stands for the Skills and Experience for the Careers of Tomorrow, sector for short, and it offers skills training and paid work experience in high growth sectors that offer career pathway opportunities and family sustaining wages for people impacted by the justice system. As we know, one of the largest determining factors for successful reintegration into society and to prevent future justice involvement is having a good, stable paying job. So any kind of employment and earnings is what we're looking for, any increases, because we have that there's a direct relationship with that and reduced recidivism. The sector program is funded by our Prop 47 grant and AB 109 funding. We're currently operated by 5 community-based organizations in the highest needs areas of LA County, and we have served 1,500 participants since the program started in January of 2021. And I'll say of the 1,500, about over half of them have completed trainings, and again in high growth sectors, and over 500 have been employed. So we're really, really proud of the employment rate we're seeing for these folks. That's just a picture of some of our sector participants in a solar panel installation training with Paving the Way organization in Lancaster, California. So in our far reaches of LA County. So next slide, please. So the sector program, core program components, again, the skills training and paid work experience. And the real benefit of this and kind of set this apart from other training programs that it really results in industry recognized and stackable credentials, meaning that somebody can start with some credentials, and then if they decide to continue with their either vocational training or education, these credentials will accrue over time. They receive financial assistance provided through stipends during skills training. We know how important it is to make sure that people are supported financially so they can not only enroll but complete training. So that is a key component of the program. Career coaching, job readiness, and referrals to other services such as housing, transportation, and food assistance. This is all provided by staff with lived experience. Again, the idea of using peer navigators, credible messengers as real, reliable and credible, trusted sources for the clients. We have therapeutic services, including cognitive behavioral interventions, group sessions to prevent recidivism and develop problem-solving skills for the workplace. There is a lot of research done that has shown the effectiveness of using CBI with those who have been involved in the criminal justice system to prevent future criminal activity. And lastly, and most importantly, placement into jobs with employers upon training and work experience completion. And so we put up actually a lot of effort into developing relationships with employers to really show them the benefit of hiring people with criminal criminal backgrounds, people who have justice involvement. There's a lot of research and studies that have shown that people with who are justice involved are very loyal employees. They're dependable. They have very strong work ethic and are hard workers and deserve as much as an opportunity as anyone else. We're really proud of the employer relationships we've developed and the partnership that we have with the Department of Economic Opportunity around the Fair Chance Hiring campaign. Last slide. Great. I'll just end with our sector program providers for those who are interested. We're working with the Alliance for Community Empowerment in the San Fernando Valley, the Anti-Recidivism Coalition, Chrysalis, Friends Outside Los Angeles, and Paving the Way, and it was a partnership with the Center for Living and Learning in the Antelope Valley and San Fernando Valley. Again, and this slide also shows the various sectors. Again, the key to this program is that it is a sector-based approach. It's kind of what sets it apart, makes it a bit more innovative than some traditional job employment and training programs, is that we've specifically targeted sectors that are poised for high growth and sectors in which this population, in particular, people with justice involvement, have traditionally been underserved in and kind of, to be frank, kind of cast out of. We're really trying to bring opportunities for new developing industries such as green construction, entertainment, IT, all of these burgeoning industries that are benefiting a lot of people in LA County and have actually relatively low barriers to entry. So we want to bring these opportunities to this population as well. I think that is all I've got. Yes, thank you so much. And I look forward to any questions or discussion. Thank you.
Thank you very much, Vanessa. Next, you'll hear from the Department of Public Social Services Division Chief over the Medi-Cal and In-Home Supportive Services Program, Sherry Cheatham. Please go ahead, Sherry.
Good morning. Well, good afternoon, everyone. Today, as you've heard, we're here to talk about transition services. And many folks will know that DPSS offers a wide variety of programs, and we're known as the safety net program of temporary assistance to help people get back onto their feet. So first, before I speak to our transition services, I want to talk about our programs real quick and what they offer. Next slide. Next slide. So first up, let me share a little bit about General Relief. General Relief is our county funded program that provides cash aid to indigent adults, children in some special circumstances, and couples without dependents. And all of these individuals are those who would have been ineligible for any federal or state programs. On the slide, you'll see that you have to be a county resident. At application, a bank account with less than $100 on hand, personal property, no more than $2,000. And for those who are able-bodied, which means who are not disabled and are able to work and employable, they can receive general relief for 9 months out of 12. And General Relief also offers a general relief opportunities for work program, which is where individuals have the opportunity to increase their skills, be part of training programs, and participate in some of our career pathway programs. We also offer record expungement services through the General Relief Program. Next slide. CalFresh. Now, CalFresh quickly has many names. Nationwide, it's known as the SNAP program, the Supplemental Nutrition Assistance Program, but better known locally as CalFresh, and formerly known as the Food Stamp Program. Now, the intent of the CalFresh program is to improve people's nutrition in low-income households by increasing the buying power for food. So foods with sufficient nutrients can be purchased to meet their needs. And CalFresh program also offers homeless or elderly and disabled customers to receive purchased and prepared meals from restaurants participating in our restaurant meals program. Next slide. Medi-Cal. Before I speak to Medi-Cal, I do want to mention we have another program, which is CalWorks, which is formerly known as AFDC. And that program temporarily provides financial assistance and employment-focused services to families with minor children. And that program is known as GAIN. GAIN, I know what the acronym stands for, have known it for over 30 years, but it's escaping me at this moment. But GAIN is a mandatory employment-related program that's designed to lead our customers to self-sufficiency. That program also includes expungement services. It also offers transitional service career pathway programs, even some with being hired temporarily by the county. So before I move on to Medi-Cal, which is what you may see on the slide, I want to talk about our transition services. Pre-pandemic, many of our eligibility staff were co-located in the community and co-located in some of the jails. We've had programs to help our formerly incarcerated individuals to easily obtain benefits. We had the Sheriff Homeless Release Project, where our team was centered in the Men's Central Jail, Pritchard's Detention Center, and the Century Regional Detention Center. We were there on site to help individuals complete applications up to a certain point. And at the point of release, the applications and the individuals were taken to one of our district offices, generally our Civic Center office, and the applications processed at that point. So upon release, those that chose to go immediately to the district office could have benefits the same day. We also had eligibility staff located at the community reentry resource centers. And the team there were focused on CalFresh and Medi-Cal eligibility. They would take applications and process the applications so that the individuals could quickly access CalFresh and Medi-Cal benefits. We were also stationed at the AB 109 hubs, where we were at the Florence Day Center Reporting Center, Pomona, East Valley, and Lancaster probation hubs. And our teams at those locations also took applications for our programs, CalWorks, CalFresh, Medi-Cal, and in order to help individuals connect to benefits that they needed to help lead to self-sufficiency. During the pandemic, all of our teams were called back in an abundance of caution, with the exception of Medi-Cal. And I'll talk about that more in a moment. But post-pandemic, the pandemic was officially ended May 11th, earlier this month. And with that, we are now restarting our jails programs. And we're looking at how to best do that. Pre-pandemic, who knew about Microsoft Teams? We didn't. Post-pandemic, we're looking at doing things in a different way that will allow us to to better maximize our resources. Our resources, the correctional facility resources, but will not diminish any of the services that we would offer to the community. Now, that said, I want to move to Medi-Cal. Now, Medi-Cal is the local name of the federal Medicaid program, and that it provides comprehensive healthcare coverage to families and individuals with limited income and resources. Really, it offers free or low-cost care coverage to those who are unable to afford the cost of their medical care. And as of April, we have over 3.7 million LA County residents who have access to health coverage through Medi-Cal. With Medi-Cal, pre-pandemic, there were several iterations of grant programs where we partnered with the LA Sheriff's Department and our probation department and our Department of Health Services to ensure that those individuals that were incarcerated had access to a medical coverage. At the time, we would take applications and hold them until they were 30 days before their release, and we would process the application to make sure that upon release, the individuals were immediately who had access to health services. Now, under CalAIM, which is California Advancing Innovating Medi-Cal, the goal of CalAIM is to transform Medi-Cal into a more comprehensive healthcare system that will offer more coordinated and equitable access to services to better serve and address physical, behavioral, developmental, dental, and long-term care needs for Medi-Cal beneficiaries. And these are those who have historically faced structural racism in the traditional healthcare system. So with that, the goal, one of the key goals of CalAIM is to address the poor health outcomes and disproportionate risk of illness and accidental death among justice-involved Medi-Cal eligible adults and youth as they re-enter the community. So with this, we are taking the service that we previously had in the county jails and in the state correctional facility, where we will take an application, process that application, suspend benefits until they are released, until 90 days before their release. And then we turn back on their medical benefits. So upon release, they're able to access care, better access care. Now, while in the facility, they, and this is stepping a little out of my lane, so I'm going to be brief. While in custody, you have the Department of Health Services there to address physical and medical needs. You have the Department of Mental Health Services to address mental health needs, and you have the Department of Public Health there to address substance abuse needs. So upon exiting custody and our Medi-Cal, their Medi-Cal benefits are turned back on, they're able to continue the care that they received while in custody in the community. Now, while the Medi-Cal process has been available throughout the entire pandemic, I said earlier that the services, the jail in-reach services that we had before were halted due to the pandemic, but we are currently restarting. We're looking to restart those, but in a way that will better benefit the Medi-Cal beneficiaries and those that would like to apply for our other key programs and services. So that's all I have. And I will turn it back over to our moderator.
Thank you, Sherry. Now you'll hear from Dr. Jennifer Hunt, who is the Department of Mental Health's Acting Senior Deputy Director of Reentry Services Division. Please take it away, Jennifer.
Good afternoon, everyone. And actually, I'm fortunate that my colleague, the other Acting Senior Deputy Director for Outpatient Services, Theon Perkins, is here with me so that we can both share about what's going on and the services that are available to individuals once they exit from the jails. So we wanted to talk about the programs that are under the Reentry umbrella, as well as how those connect to our outpatient services umbrellas of care. Our goal is to have everybody receiving care in the community. Next slide. So as our colleague from DPSS kind of gave the intro related to CalAIM, there are some focuses on making sure that individuals, when they leave the jails, have access and have active Medi-Cal. And so there are a lot of things that all of the health departments are working on right now in collaboration to really support that. And so some of the things that we're doing that we want to be able to support our community members are through some of our community programs, such as our clinicians and teams that work in the mental health courts. We have programs such as Rapid Diversion. We have our court liaison and linkage program, supporting individuals that have justice involvement. More specifically, and really talking about the reach-in services, but then also connections into the community, would be the programs from our community engagement division. And we have the men's and women's community reintegration programs. They do outreach, if you want to call it, but within the jails, and are engaging clients into services so that when they are released, that they have a community resource support and mental health team in place to be able to receive those services and to help them in their transition. We also have a program that is still court associated. It's assisted outpatient treatment, but those are for individuals that, again, have certain criteria with some justice involvement out of concerns for some more severe mental health concerns. And then as we transition from the reentry component into our more global outpatient services and care, we have one of our flagship programs, which is called Full Service Partnership. Next slide. And I was gonna say, I think, do we give you the prompt?
Yeah.
And I already kind of touched on this. I don't want to keep on it too long. There we go. So those are the programs I softly outlined, but I want to be able to, if we can go to the next slide. There we go. Hand it over to my partner to talk about some of the outpatient services.
So outpatient services are provided by field and clinic-based teams across the county to meet individual needs of clients, and our services provided by clinical teams in multi-languages and led by culturally sensitive approaches, including trauma-informed care and other evidence-informed practices to meet the client's holistic needs. Meaning we have that range all the way to older adults with our Genesis program, which is an older adult program that literally goes out in the field. There is no brick and mortar building for them to see clients. They see them where they are. With the Mental Health Service Act, which is funded by Prop 63, provides many programs, including full service partnerships, as Jennifer has mentioned already. And it really is our flagship program, which kind of really acts as a linkage from when people are released from jail and they have a persistent mental illness and they need services. It's the wraparound service. Full service partnership is a continuum of care focusing on servicing and meeting clients wherever they are in the community and supporting their path to recovery and wellness. And the goal of full service partnerships is ultimately to provide clients with a bridge and get some real stability wrapped around them to ultimately bridge them to our outpatient care services, to our outpatient clinics, where they no longer need as much care and as much wraparound services as the FSP program. So that's the ultimate goal, is to have this continuum of care. And then finally, to have people graduate to even be able to participate in services in our PRCs, which is our peer-run centers across the county, where people that have been in justice involved are now operating, which is really a blessing, and working in our county systems to provide services to their peers. So that's the continuum of care in the Department of Mental Health, again, from FSP all the way down to the Peer Resource Center and all these different pieces in between to really try to help people stay in the community. You know, Jennifer mentioned briefly about the court linkage. That program is so important because it really tries to get people linked back into the community where they won't be held in jail, where they can really have services wrapped around them in the community where they live. That's what's so important about court linkage.
And to piggyback on that, I think one of the other big pieces that we're going to hopefully have a lot of momentum behind is with CalAIM and what they call path funding. So as the state has been looking at some of the areas of concern related to individuals losing their Medi-Cal, for example, when they're incarcerated, and the difficulty oftentimes with getting that Medi-Cal back. And I know DPSS are amazing partners, but holistically, people have difficulties getting services. And so we want to be able to address at the state level, they're addressing that through this new path funding process, which is going to be focusing on the justice involved reentry initiatives, where the application for Medi-Cal, there's going to be some changes and some supports and resources brought on with that. There's going to be a focus on the 90-day pre-release time where we can help support the eligibility screenings, where we're able to also look at the service delivery, which is that reach in, where our teams, specifically in the reentry programs at DMH, can work with and coordinate with the services that individuals are receiving while they're incarcerated. Unfortunately, we are not the provider within the jail. That's Correctional Health Services, which spoke about the services last time in this series under Dr. Belovich. But where we come in is that, as was shared, that we take over the services when the individuals are outside of custody. So if that's in a diversion program, if that's through our advocacy and work to get the treatment programs in place of or in lieu of, in collaboration with JCOD and some of the partnerships with ODR and a lot of our other county partners, we're working on ways to have individuals receive care in lieu of jail. And so these are kind of just the different pieces and connections, hopefully, with CalAIM. And as Commissioner Luis had shared earlier when he mentioned the whole person care, I went, oh my goodness, that's our throwback term, right? And so now that concept and that need is still there, but we now call it ECM, which is enhanced care management. And so that's another term that you will hear in this space related to reentry and related to linkages and making sure that we have warm handoffs for care, in that we want to make sure that individuals are successfully linked and receiving the appropriate level of care and service that they need. And ideally, as they re-enter into the community and they step down in their care, they would then be going into programs that are overseen by my colleague, Theon. So the two of us, as we literally sit side by side in offices here at the building, that we see our services in the same way, where we're working together and hand in hand, just making this one seamless fabric of care. And I think we do have is this our last slide, or do we have one more? There we go. There's our ending slide.
Yeah.
So we thank you for the opportunity to come and talk about this, and look forward to dialogue at that time.
Thank you, Jennifer and Theon. Now you'll hear from Lieutenant Joe Covarrubias, who oversees the Sheriff's Department Community Transition Unit. Please go ahead.
Thank you, Commissioner Garcia. I appreciate the opportunity to share with this commission the many functions of the Community Transition Unit. The Community Transition Unit has custody assistant case managers at all 7 of the Los Angeles County Sheriff's Department custody facilities, and the headquarters is located at the Inmate Reception Center. The case management begins as soon as the justice-involved population are assigned to permanent housing. It is at this point case managers begin creating a relationship with those entrusted into our care and custody to market the wide range of services available to the population and commence release planning for success. During the face-to-face interaction, case managers begin an application process for birth certificates, California identification cards, as well as contacting self-identified homeless individuals to provide the population with the necessary tools to succeed in obtaining jobs, transitional and permanent housing, and additional services upon reintroduction into the community. The Community Transition Unit case managers begin a risk and needs assessment using the COMPASS tool to identify candidates for programs such as alternatives to custody, community-based alternatives to custody, which allow for placement of residential substance abuse rehabilitation programs, work release programs, and station workers. Individuals qualifying for the mentioned programs serve their remaining sentence while wearing an electronically monitored global positioning system on their ankle. During this case management at each facility, Community Transition Unit works with the United States Veteran Administration to identify and provide supportive care justice individuals in the jail who are veterans. The relationship provides a vital programming and referrals to housing, mental health, and Veteran Administration sponsored medical services while they're in custody and after their release. The relationship between the Community Transition Unit and Veteran Affairs ensures a warm handoff to the Veteran Administration, which allows for expedited resources such as job placement, housing, and counseling. The Sheriff's Department also has a program where we work with correctional health services to comply with provisions set forth by paragraph 34. Paragraph 34 requires justice-involved individuals with mental illness leaving the jails are offered comprehensive, compassionate release planning. While some of these release programs services are provided by employees and contractors of the Department of Health Services, release planning obligations continue to require operational support and coordination by the Community Transition Unit, such as escorting clinical staff and service providers, escorting prospective candidates to and from various jail locations, and housing, assisting in identification and or benefits, transportation, mental health, substance use services, income benefits, and community social supports. Next slide, please. I'm sorry, could you go back one? Thank you. Thank you. The Community Transition Unit manager also assists in managing the pregnant population at the Central Regional Detention Facility. As a newly identified pregnant individual in the correctional setting comes in, the Community Transition Unit personnel use a COMPASS tool to identify the candidates for programs such as alternatives for custody and community-based alternatives to custody, which allow for placement in residential substance abuse rehabilitation programs. All of the justice-involved population who are pregnant at Central Regional Facility are offered applications for birth certificates, applications for California identification cards, housing resources, employment resources, substance abuse resources, CalAIM, which is Medi-Cal, education-based incarceration while they're in school, as well as if an individual identifies as homeless and has a regular release with going to no program, the individual is identified, screened, and is referred to the Homeless Healthcare Initiative Whole Person Care Program to assist in creating a release plan and provide transportation to a suitable shelter or housing. The Community Transition Unit continues with the case management by following up with the individual after each court date, keeping track of the sentencing and programs offered at the courts. The goal is to provide the necessary tools to succeed and obtain jobs and additional services upon reintroduction into the community. Next slide, please. Another area that the Community Transition has excelled in is the Justice-Involved Population Voting Campaign. It is the mission of the Community Transition Unit to provide every person in custody with the right to cast a vote, just like if the individual was out in the community. The Sheriff's Department, in collaboration with the Los Angeles County Registrar's Office, meet and discuss registration and voting timelines. Community Transition Unit personnel distribute informational forms posters at all the facilities within Los Angeles County. The Los Angeles County Sheriff Department food services at each facility places informational voting in the lunch bags for distribution, ensuring that every justice-involved individual has access to the information. An instructional video explaining the voting process is played at each facility, including the inmate reception center during booking and release processes. Community Transition Unit visits every jail location and housing unit to distribute voter registration forms and encourage participation. The Community Transition Unit staff are all trained in voter registration and polling by the Registered Recorder's Office and assist with the registration process, guide the justice-involved population in filling out the forms, and answer any questions. Once the registration forms are complete, the Community Transition Unit collects them and promptly delivers them to the liaison at the Registered Recorder's Office. This process is repeated until everyone in the justice-involved population who wishes to vote has submitted a completed form. The Registered Recorder Office determines voting eligibility, and a ballot is printed for those who are determined eligible. The ballots are picked up and organized by facility. Our Community Transition Unit staff distributes the ballot to each facility along with a ballot bin. Everyone is given sufficient time to complete the ballot, and the Community Transition team offers the option of dropping the ballot into a ballot bin or sending it via U.S. Postal Service. Again, this process is repeated until all facilities have collected the ballots. During the November 22 general election, Los Angeles County Sheriff's Department, partnered with the Registered Recorder's Office, was able to provide voting opportunities, in-person voting opportunities at Central Regional Detention Facility and Pitches Detention Center South. In planning for the 2024 election, the department, as well as the Registered Recorder's Office, collaborative goal is to expand in-person mobile voting to all jails within the county. Next page, please. In collaboration with our partners at the Department of Social Services, a dedicated team of Community Transition Unit custody assistants assists with the newly adopted CalAIM initiative, which ensures that the justice-involved population who are released from county jails receive timely access to Medi-Cal. Under CalAIM, the Department of Health Services is implementing an enhanced care management for justice-involved populations, improving behavioral health linkages upon release, and seeking approval for federal Medicaid financing for incarcerated individuals. Pre-release Medi-Cal enrollment allows individuals who are incarcerated access these sets of services. The Sheriff's Department involvement is that when an inmate is involved, when a person is involved during booking at the Inmate Reception Center, the person is determined, is screened, and folks who do not have Medi-Cal are identified. The Community Transition personnel facilitate relationships, conduct face-to-face interviews, and submit Medi-Cal benefits on behalf of the inmate population. The Community Transition also is assisting with trying to identify means to identify persons who are being released within 90 days to ensure that their Medi-Cal has been provided to them prior to their release. Last page. As part of the continued relationship, the Community Transition Unit case managers continue case management of the population from initial booking to release and beyond. As the individual is in the release area being prepared for release, Community Transition Unit case managers contact the justice-involved population hourly to offer services post-release. As a last-minute follow-up with the individual being released, a service window managed by a Community Transition Unit custody assistant invites the individuals to visit one of the 8 Community Reentry and Resource Center windows as they exit the facility. The Community Reentry and Resource Center, in collaboration with the County of Los Angeles Department of Health Services, Health Right 360, Homeless Healthcare from the County of Los Angeles Department of Public Health, California Department of Corrections and Rehabilitation Division of Adult Parole, Volunteers of America, and the County of Los Angeles Probation Department collectively provide services such as prescriptions, wellness center information, Medi-Cal insurance verification, instructions to DPSS food stamps, location and general relief, help with clothing, apartment and subsidized housing, drug and alcohol referrals for inpatient and outpatient services, referral to DUI and domestic violence and anger management treatments, on-site substance abuse assessments for referrals, parole reporting instructions, mental health correctional clinical case management and house outpatient programs, proof of incarceration, emergency shelter information, information on obtaining custody medical records and case expungement information, employment referrals, TAP cards, taxi vouchers, referrals to what we refer to as a refresh spot, which is where an individual will have an opportunity to shower, use a restroom, do their laundry, and perhaps charge their cell phone. Referrals to numerous food banks, such as one that we have a block away from the facility, which is a Center for Health Justice, which provides meals. We also do employment referrals, food bank locations, formal and summary probation information, case management, and much, much more. The Community Reentry and Research Center windows are at the Emory Reception Center lobby and currently operate from 6 a.m. to 4 p.m., Monday through Friday. My goal is to extend the hours to mirror the Emory Reception Center release hours from 6 to 10, 7 days a week, to ensure that the opportunities are afforded to everyone being released at various times. As you can see, the justice involved population has many resources available to them from various entities who share the common goal to provide a plethora of services covering both pre and post-release. Thank you.
Thank you very much, Lieutenant Covarrubias. I'd like to thank all the speakers here for providing the information on the county's efforts to ensure that people transition smoothly out of jail. As we have all seen, even with all the well-intentioned programs offered by the county, there are still significant gaps that allow people to fall through the cracks into poverty and recidivism. Our conversations here today are important, and we hope to build partnerships that improve that system to actually support people. Before we jump into questions from the public, I'd like to ask the panelists a few questions. And for my first question, I'd like to start with Sherry. And specifically, my focus, you mentioned since the Department of Social Services is the responsible department for individuals getting into general relief benefits and as well as Medi-Cal. Currently with the CalAIM shift towards enrolling people into Medi-Cal, prior to their first, the last 90 days in their sentence in county jails and state prisons and the youth correctional facilities. Where is the Department of Social Services right now in this implementation?
Thank you for the question. So I think I may need to clarify something. The opportunity to apply for Medi-Cal while incarcerated has been in place for many years. Whether it's under whole person care, it was under whole person care, whether it was under AB 79 Health Navigators Grant, or in the period in between the sunsetting of the Health Navigators Grant and the launch of CalAIM, we've always had the ability to take an application from those that are currently in custody and approve their Medi-Cal or deny, which there are very, very, very few denials, if any at all. I can't remember any that's being denied while they're in custody. So under CalAIM, the existing program that we had is being enhanced. We're increasing a lot of the automation and discussions between not only DPSS and LASD, but also with DPH, DMH, many of those that are on the panel today, improved and enhanced communication so that the individual is looked at as a whole. So when they leave, that they have a whole package of care, this whole continuum of care. When they leave, they can continue their treatment and potentially lead to better self-sufficiency. So we didn't just start with CalAIM in January of 2022. We've always had some version or iteration of this program. And I would like to also add, it's not just for those that come into custody and are asked or offered to get Medi-Cal. Those that have Medi-Cal insurance, when they enter the facility, the Medi-Cal benefits aren't terminated, they're suspended. And then when they reach that critical point right before they're released, we unsuspend, so to speak, their benefits. So again, everything that we've all spoke of before about the continuum of care, the benefits are turned on so they can continue with their treatment, continue with their health plan. So we've always had a version of it. CalAIM is just enhancing it.
Okay, thank you. And my next question is for Lieutenant Covarrubias. You mentioned, you shared about the CTU, or well, I believe it's the Community Transition Unit, where the vital documents such as birth certificates and California ID applications are completed. Now, is these applications completed while in custody, or when they exit and then they stop by at the windows there at the CTU?
Great question, Commissioner. Those applications are submitted and to the various entities while the inmate person who is in custody is still in custody. To obtain a birth certificate, it takes somewhere from 2 to 3 months to obtain the birth certificate. And once the birth certificate's returned or sent here to our office, it's placed into the person's property so that they have it accessible upon their release. Same thing with the identification card. The application's processed here while the person's in custody, and once the identification card is obtained by our office, again, it is placed onto the person's property, so again, they have it available upon their release.
Okay. Now, in relation to like individuals that come into the jail, say they're just a county sentenced inmate, and they're not connected to any kind of correctional health program or DMH, but they're just kind of like a general population person, and they recognize that they want to get some help when they get out, and they may be in a, say they're housed in Min Central Jail up in a module or something, and is there access to the availability of services to like reentry services that would start at that point in the jail, or does it kind of spread through specific facilities?
Was that a question for me, sir?
Yes, I'm sorry.
Yeah, no problem. We do have what we refer to as a inmate request form, which is accessible to everyone who's incarcerated in the LA County Jail. And as part of that process, there's checkoffs and information and needs that are requested through that form, which is eventually, say it for something like you spoke of, someone who wants to speak or to one of our case managers regarding a identification card or maybe a referral once they're released from custody. They fill out the form and it's submitted and brought to our office. And also when our case managers are out talking to them and doing the face-to-face interaction, creating the relationships with these folks, they're able to gather that information, come back and get the process going for whatever their needs are.
Okay. So the starting point that would initiate that process would be the inmate request form.
Well, it could go either inmate request form, or as our case managers are walking through the actual dorms and facilities, speaking and explaining about and basically selling our ability to provide these services as we speak with them face to face.
Okay, thank you.
May I just chime in on one more piece of that real quick?
Sure.
Is that there's also, I know because it's part of our workflow planning for CalAIM, that at IRC, when they have their evaluations by the physicians there. And there's other requests which will then be followed up with correctional health services, care transitions, and whatnot as well. So there are many different avenues that different types of needs can be addressed, and making sure that we all coordinate and cross over. That's a lot of the work that's being, I think, refined is the best way to say, and enhanced, as Sherry said, with CalAIM. So it's definitely on the radar, I think, of everybody.
And thank you for that comment. My next question was going to be directed towards you, Jennifer. And
So I spoke up early.
one of the things that I've seen in my role as a clinical social worker, and the role of so an individual, and this is a real kind of case story, an individual gets out of the jail and they are moved into, or they flow into DMH care, specialty mental health. And then they go through specialty mental health, they're in there and they meet their clinical goals, and then they're considered, they'll step down into mild to moderate managed care Medi-Cal systems. And I've gotten referrals from DMH outpatient clinics, for people that are seeking now to continue their services, but at a mild to moderate kind of step down in the managed care system. I understand, the majority of the individuals that are in the jail, whether they're, accessing correctional health services and they need mental health services, and then they come into the community and then they enter into DMH system of care. Is there any data that's tracked on people that will, like, they step down into the Medi-Cal managed care plans? Does the department track that?
Theon, you're muted.
Kind of as a result of CalAIMS, we are really looking at that closely and starting to track. There's been some tracking, but not as much as we're trying to do now because of CalAIMS and because of the tool that the state put out this past January for us to start identifying when people are more appropriate for mild to moderate services. So we are tracking that now in the department. What has happened historically, honestly, is people, even though they kind of graduate down, and that's another reason why we've kind of really stood up our PRCs, people tend to not want to leave DMH. And we're because they're used to their clinicians. They're used to this team of people that they work with. Even though they've met all their goals, they don't really want to kind of let go. So we've stood up some of our PRCs so people can transition into a space where they still have access to us, but they are providing, are operating more, are being served more by their peers. And so they're still linked, but not so much so. We are trying to transition people to managed care, but what we've found in some cases, people want to come back, or they feel like I can't get an appointment with the managed care person as quickly. So we are tracking all of that now and trying to see how we can help tighten up that. But the managed care systems across our system, they do not have the bandwidth, that's just being honest. DMH has over 190 providers. It's more than that. But managed care doesn't have all these multiple providers that they could actually, link people to. So again, we are starting to track it more as a result of CalAIMS and as a result of the new tool that, the state had to start using as of January 1st. I hope that answers.
Yeah, thank you. CalAIM has really kind of shifted a lot of things and brought out the role of the Medi-Cal managed care plans in reentry, because, like, as you say, a lot of the providers are limited. So my next
But DHS is helped as well, not to really overstep. DHS has helped because they've stood up their own behavioral health, and so they're also taking some of the things that managed care would would be more appropriate for managed care, but DHS is doing that mild to moderate as well. So we have things that are lifting up in the system to try to manage this kind of overflow. It's a better way to say it. Yeah.
Well, and to make sure that we're really addressing people's needs, right? So the current CalAIM is also helping us from a system standpoint because of the data sharing and the technology and the money focusing on the infrastructure. So I think that Sherry, I'm gonna have to quote you every time I say it now about enhancement and enrichment, right? That's what it's doing. It's allowing us to make this a better, more efficient operation. And so the different ECM programs within health services, DMH, that we're all meeting, and DPH with SAPC, and we're all meeting very regularly and trying to really align and figure out what are the best ways to be able to effectively work together to get client services in the best way possible.
And think of it this way: if you're a client receiving some ECM service and you need to transition to SAPC, or you need to transition back to DMH, and if you were at DHS, with enhanced care management, there's less of a chance for you to fall through a crack because somebody's holding your hand, somebody's walking you through this system. Because if, as you know, or you may not know, it's not as easy if you're just some layperson trying to access any of our county systems. You know, you look at our web pages and you just kind of scratch your head, and sometimes. So, you know, ECM that's really why it's there, to kind of help people and guide them through and make sure that they don't fall through, and that they get a call back, they get what they need.
So thank you. And my last question will be for Vanessa. And in your description, you know, of the services provided through the numerous CBOs, is there services that may be helpful to families that are welcoming home their loved ones and trying to aid in their successful transition back to the community?
Yeah, thanks for that question. You know, all our services are focused primarily on the individuals themselves, but you know, it's always, you know, the goal is to have a holistic approach and trying to figure out how to work with them and their families, especially on family reunification issues, you know, particularly with mothers looking to reunite with their children. We provide those services through our Doors Community Reentry Center, which is one of the programs that I didn't highlight as part of my presentation. But that is what we call a one-stop shop for services. We have our first of its kind in LA County was opened on Vermont Avenue between Exposition and King. We are now expanding to the Antelope Valley, and the goal is to have one in each supervisorial district. So the first one that we've implemented was through, in partnership and close collaboration with the probation department. It's actually on the third floor of one of their buildings. So we receive a lot of referrals from probation. And one of the many services, we have both community-based organizations and county partners. Our good colleagues here from these departments, we have DPSS and DMH and SAPC and other county departments in the space providing services. And family reunification is provided through a New Way of Life reentry project. So yeah, so that's, you know, that's specifically around family reunification, and not just for women. You know, it's predominantly women reuniting with their children, but it can be for the fathers as well. But yeah, there is, you know, a lot of effort, especially at Doors, to you know, incorporate programming for children and families.
Excellent. Well, thank you all. And now I'd like to open this up to the live Q&A portion. Jennifer, are there any community questions for the panel?
Yes, we do have a number of individuals who have already raised their hands, so we'll go through those in just a second. So we've got Terry, Bernita, Vanessa, Alicia, and Crystal. But before we get started, as a reminder, if you have logged into WebEx to ask a question, please raise your hand. If you have called in, please press *3 to get in queue to be unmuted. I will unmute you when it's your turn so that you can ask your question. If your question is for a specific panelist, please feel free to state that. To ask a question, you must be logged into the WebEx or phoned into the meeting. If you are commenting on the Facebook Live video, your question may be read by the host. And before we begin, we will have a quick announcement in Spanish. So Eric, if you would like to go ahead with your announcement.
Hola y buenas tardes. Si ha iniciado la conferencia por WebEx y gustaría hacer una pregunta, por favor toque la imagen de la mano y alguien le ayudará. Si está escuchando la conferencia por teléfono, por favor presione *3 y alguien le ayudará cuando sea su turno. Si su pregunta es para un panelista específico, por favor indica eso al comienzo de su pregunta. Por fin, si está viendo la conferencia en vivo por Facebook y ha hecho un comentario, la anfitriona va a leer su comentario al grupo. Gracias.
Thank you. And Terry J, I've sent a request for you to unmute. If you can acknowledge that, that would be great. Just as a reminder, this is for questions. It is not a public comment session, so we will not have a timer. We'll just be taking the questions as they come. So Terry J, a request has been sent for you to unmute. If you can, on your device, just acknowledge that unmute request. Okay, and seeing no action from Terry J at this point, we'll move to Bernita Walker. A request has been sent for you to unmute, and you're unmuted, Bernita. Please go ahead.
Hello?
Yes, we hear you, Bernita. And Terry, I see that you're unmuted. If you can just stay there, you'll go right after Bernita. So please go ahead, Bernita.
Thank you very much. Good afternoon to all of you, and thank you for the information that you shared. It's extremely important and is needed to be in the community. And to my question is, in comparison to the services that you talked about being available, what percentage of those that are presently incarcerated are those who are recently released, taking advantage of that? And how can the community assist in getting this information out? Because it's not, I don't know about the information. I live in the community and I'm very active, as you can see from what I put in the chat. So how do we get this information out? Because this is very vital to our communities.
Thank you for that question, Bernita. So for the panelists, if any of you have any information about your community outreach efforts to inform the community, that would be helpful to chime in now.
I'm going to speak for the, go
chime
ahead.
in.
Sorry. I'm sorry.
Sorry. I'll just jump in really quickly, but yeah, so as I mentioned earlier in my presentation, the services that we provide are all through community-based organizations. So we do a lot of community outreach through, again, our Reentry Intensive Case Management Services program, our sector program, our Doors Community Reentry Center, which I just mentioned. So it's a very large part of all of our programming is the community outreach piece. I don't know if that answered your question, but I can speak more specifically about that. Yeah.
Thank you for that. And Theon, did you have anything additional to add?
For DMH services, I would recommend folks that are online listening to get involved in the health neighborhood in your local service area, or your SALT meeting, those two, but really the health neighborhood. It is a collaborative meeting with not only mental health providers, law enforcement, you name it, comes to the table and talks about what services are available in that community. We also have faith-based in that particular meeting, and it is available in every service area throughout our county. If there's somewhere for me to share this information, it's on on our DMH website. And if you looked up health neighborhood, it would take you, and you put the zip code in, it would take you to the meeting and the dates and times. So that's a place for this information to be dispersed for at least DMH as it relates.
Very good. Thank you. And we will upload everyone's PowerPoints onto the commission's website, so those will be accessible. And if you have any questions following this directly for any of the panelists, you can email the commission's email at cocnotify@coc.lacounty.gov, and we'll go ahead and forward it on to the panelists. So with that, we'll move on to our next question from Terry J. Terry, please go ahead.
Hi, good afternoon. My name is Terry J. I am the program coordinator for the Reentry program. I work with Trans-Latino Coalition. Trans-Latina is a trans-led organization that is working for our TGI people. TGI stands for Trans, Gender Nonconforming, and Intersex Community. I work directly with those who have been released from county jails under the Reentry program. And one of the things is that the biggest topic that is not being addressed today, or just overall, it's a big issue, is housing placement. A lot of these individuals who are faced or going into incarceration, during incarceration and being released from incarceration, have faced and are currently facing homelessness. So we're not talking about homeless individuals who are going through AB 109 and diversion process. When they're released from county jails, they really have no place to go to. We're talking about not only the DMH FSP to get into some type of housing when it comes to mental health issues. We're talking about shelters and programs. We're also talking about what is missing with this whole component of this Reentry program, specifically for our TGI people, is that we are lacking housing. And one of the solutions is transitional housing. Where does the funding come in from the state or even from the county that we need funding for transitional housing? We do need added on transitional housing for AB 109 and diversion for those individuals who are currently experiencing or facing homelessness when they are being released from county jail. I'm going to be the devil's advocate in this conversation because we really need to do a wraparound services. When we talk about Reentry program, is used loosely, and I think for me as a program coordinator, I'm also a case manager. I work with those individuals who are going through a Reentry program. I have more success high rate with TDCR in finding state funding on transitional housing for those who are being released from prison. I have more success with that. I have minimal success with AB 109 when it comes to transitional housing because they are placed in line guard. It's not a safe, conducive environment for those for transitional housing, for those who are going through Reentry program, especially for our TGI people who are accessing Reentry program because they're placed in housing, shelters, and programs that are not conducive for our TGI people with the environment of being discriminated, faced with all of these stuff here. So I think it's important that we do have transitional housing. How do we get more transitional housing for our TGI who are falling through the system?
Thank you for that question, Terry. And for the panelists, I don't know if anyone has any information regarding transitional housing. If you'd like to chime in, yes, feel free. Thank you.
So one of the things that, as we talked about CalAIM, one of the big focuses for DMH at large is to increase our housing portfolio. And I appreciate, Terry, the things that you were saying and sharing, because we petitioned and put forth a proposal to the state. They were looking to allocate $329 million for us to utilize here in LA County. And so we have offered to and want to increase the housing with an array of different things that I think will touch upon the needs of certain community members, as you're describing, that need safe places to stay that are not potentially connected to other programs already. So that is something that is coming up that we're working on and expanding. And that is, again, another active conversation to try to expand that portfolio right now.
Thank you very much for that, Jennifer. Did anyone else want to make any other additional comments related to housing?
Yeah, I just wanted to jump off of what Jennifer said. We're in the same boat at the Justice Care and Opportunities Department. in wanting to expand our housing portfolio, our interim housing, transitional housing. So yes, very, very much appreciate the comments around that. I think, yeah, there are, CDCR does provide some pretty substantive and substantial funding for housing. I know that the Amity Foundation has the STOP program. We're definitely looking for more funding opportunities. I would say the best place to start is the Care First Community Investment, so formerly Measure J. They invite proposals every year for funding, and that's very much intended to funding for the community and for these particular type of programs. I know Trans-Latino Coalition has been very active in that space on the advisory committee and has lifted up these concerns. It is very much JCOD's interest to think about housing and try to develop housing where just now branching out to specific services for women coming out of CRDF and those on probation. We know that we need to focus on the more kind of other populations that need specialized and customized services. Very much appreciate the comments, and I encourage you to keep putting the pressure on to see these things come to fruition.
Very good. Thank you for that, Vanessa. And we actually have Vanessa Perez who will be asking our next question. So Vanessa Perez, please go ahead.
Hi, my name is Vanessa. My son is Joseph, who suffers with mental health. He was released from jail after 2 years. How does he become part of this program for expungements, dental care, intense trauma therapy, medical treatment? Who do I got to get in touch with in order for him to get these type of treatments?
Hi, good afternoon, Ms. Perez. This is Jose Martinez. I'm with the Department of Public Social Services. I think if it's not already part of the household, an opportunity to apply for Medi-Cal to have that initial healthcare coverage for your son would be a great place to start. It would be not only necessarily just for him, but maybe for the entire household, and then having those benefits available could facilitate any additional services that any of our programs or departments can provide.
Okay, well, like with the Medi-Cal, he has Medi-Cal.
Okay.
Recently he had a seizure about 3 weeks ago and broke his front teeth. He's waiting for the dental. How does he get his teeth fixed before it becomes even worse?
So as part of his Medi-Cal benefit, he is eligible for something called a Denti-Cal, and connecting with the Denti-Cal, and that's what it's called, Denti-Cal program. I don't have their website readily available, but through DHCS, through our Department of Healthcare Services, or just looking up Denti-Cal will provide you a quick way to register and enroll your son into a Denti-Cal benefit as part of his Medi-Cal program eligibility.
Okay. Okay, well, thank you guys for your time.
Wait, Vanessa, real quick.
Yes.
If there's a way to private message a contact information to our moderator, I will have one of our teams reach out to you.
Oh, thank you. I appreciate it.
But please just do it. Make sure it's through a private. If there's a private way to facilitate that, I don't want to be announcing your information on a recorded meeting.
Yes, and we can do that, Jennifer.
Okay,
so Vanessa will connect with you and make that happen.
Wonderful. Thank you.
Thank you. And if I can also have her information, I can share that information on Denti-Cal.
I was just gonna say we can just we'll make sure that we can get that relayed to you.
Thank you.
Great. So you'll hear a follow-up from the commission staff after this conference. Next, we'll hear from Alicia Molina. A request has been sent for you to unmute. Please go ahead, Alicia. You are unmuted, but it looks like you may have muted yourself again. Once you acknowledge the unmute, no need to touch that again. Okay, please go ahead.
Good afternoon, everyone. My name is Alicia Molina. I'm from the Department of Rehabilitation, and we definitely want to bridge that gap that we have right now with the reentry population of having steps, what to do once you're out. And this is a thing that we do provide services for the reentry population. We help them with training programs. We help them with going back to school or getting a short-term training certificate or an apprenticeship program. We're currently right now working in conjunction with the Career Expansions Group Agency, Inc. And what they do, they provide a 1-month intensive training program. They provide them with certificates such as, hold on, let me read it to you. Hold on, let me minimize this. Where is
Did
this?
we lose you, Alicia?
No, can you hear me? Can you guys hear me?
Yeah, we do.
Okay.
Yeah.
So what they provide, it's a 40 hours of internship of an apprenticeship program for the construction. They do get the HASWAPer, they get various certificates. You know, it's like when you're in the spots, like, okay, what certificates, what are their names? So I'm losing track, but they'll be able to work within the union, a great union, great benefits. We provide for the Department of Rehabilitation provides for their training, their work gear, their tools to begin with, their union dues, first year union dues. And at the end of their training, which is after a month, they are paired with an employment specialist to find them a job, to help them assist with the job. We have sometimes provided them with a bicycle to get to from places. Now, granted, these are the parolees the reentry population that are within a year within the exit program. We work with the Health Right 360 group, a Safe House. We also work with the Geo group home. So the population we're working with most of them have passed the program and have received the certificates and have been successfully job placed. And the recidivism is very, very low. So this is one of the things that we definitely do want to bridge that gap, as I said before, and continue to service this population so we can lower the recidivism. And one of the things that we do want to address is that, again, you do have consumers that say, well, I need help with housing. Once they come out of the health right, a lot of them don't have a family to house them or somewhere to go. And that's where I think for the most part, some will go back to their old ways because that's all they know how to do. And they go back to their old friends like, yeah, you can kick it here. It's fine. But you go back to your old ways, you will go back and do the same thing. So
Thank you very much, Alicia. If you could just wrap up your comments with your question.
So we're here to service the individuals, the reentry population with training and finding employment services to bridge that gap.
And tell us your organization one more time.
The Department of Rehabilitation, and I'm a counselor there.
Wonderful. Thank you very much, Alicia. And our next question will come from Crystal. Crystal, a request has been sent for you to unmute. Please go ahead, Crystal.
Can you hear me?
We do, yes.
Oh, okay. Hi, my name is Crystal. I also work for the Department of Rehabilitation, but I also sit on the IFC team from DBI prison. And I just have 2 quick questions. One of them, I'm representative for the lifers. I'm concerned about the lifers, and I hear a lot of things about the Los Angeles County Jail, but not CDRC. So my concern is, are the ones who's getting paroled from CDRC, are they allowed these opportunities as well? And if so, does demographic play a good part in it? Let me just say this, because you have some people who had a case in Los Angeles and they can't get back to Los Angeles because there's no transitional housing. So they have to settle for Central, California up north or however, and they're trying to get back there, but these particular counties don't have fundings. How can we get this information into the prison? That's my thing. No one knows about you all. This is like really mind-blowing. Great opportunities, but I only hear about the Los Angeles County Jail and not CDRC. So that's my question. How can we get this information into the prisons? Are they allowed anybody who paroles from prison, are they allowed the opportunity with AIM and everything else that you have? And also, too, does demographic play a big piece in this, where they live?
Thank you, Crystal. So I'm not sure if any of the panelists have some insight on that. Please go ahead and chime in now.
Sure, I'm happy to chime in. Thanks for raising that, Crystal. Actually, I'm very happy to announce that we actually just recently received some AB 109 funding through the county's public safety realignment team. And so that funding allows us to serve people on post-release community supervision, AB 109, or parole. And so we actually have a relationship with CDCR to receive direct referrals from those being released from CDCR back to LA County. And so they are, we're connecting them directly with the Reentry Intensive Case Management Services program, as I mentioned before. And that program will then connect them with other programs, kind of the linkage there. I also was going to say that CalAIM is also focused on those at CDCR, and those are on parole. So CalAIM is not just focused on the county level; it's a statewide initiative. And I know there's a lot of effort actually right now through what's called the Transitions Care Clinic Network in San Francisco. Is also, I know of them in particular doing a lot of work in CalAIM and in the prisons. There are definitely resources coming, and CDCR itself actually has quite a bit of resources to provide reentry services to individuals.
Hi, good afternoon. Jose Martinez, DPSS. Hi, Crystal. Just wanted to share from the Medi-Cal perspective, we do have a long-established relationship with CDCR where individuals that are going to be released to LA County, they will connect with the inmate in advance of their release, offer Medi-Cal healthcare coverage. Those applications come directly to LA County. We'll process those applications, determine eligibility, and then with that application, we're given the scheduled release date for that individual, where once the case is approved, we will activate benefits for that individual upon release. So from the healthcare coverage perspective, again, LADPSS does have a standing relationship with CDCR across the state.
Thank you. And does anyone else from the panel want to chime in?
I would like to add that, our case managers are embedded in all the jail facilities, and when we do have, for example, AB 109 or folks here from the CDCR we do offer the same services that we offer to our general population. So if anyone has a need, whether it's for Medi-Cal or identification cards, for any of the services we offer, it's extended to everyone who's in our facility. So the probability of someone obtaining an ID card or birth certificate if they were born in this county is very high. And again, we have those services for everyone.
Parole status doesn't exclude individuals from, by and large, programs at DMH. And so we do work with parole officers, and we do, oftentimes, as it said, CDCR may also offer similar, if not parallel programs. And so we try to just make sure that we coordinate. And CDCR has recently reached out to some of the county entities to try to better coordinate in that transition as well. So.
Wonderful. Thank you for those responses. We'll move on to the next question, which will come from Irma Cooper. Irma, if you can unmute from your end. We just sent the request. Okay, please go ahead, Irma.
I want to thank you all. The information has been very valuable, and I really appreciate you taking time to talk with us today. But my question is, how are you measuring your effectiveness of your services? Are you keeping track of how many people use your service, how many people complete the service? I just need to know a little bit about your success rate. And then the second question is about the voting in jails. I noticed most of the pictures were of women. So I'm just wondering if these same voting services apply to all the jails in LA County. Thank you.
Hi, well, I can answer the question regarding the inmate voting, the ability for anybody who's incarcerated is equal, whether they're in a female facility, whether in a male facility. We've even gone as far as to try to implement the in-person voting where we could go to every facility. We have our female facility, which is CRDF, and we also have our cluster of jails up at what we call the Pitches Detention Center, as well as in the basin here. And all of them have the same ability. Our CTU personnel go to every single facility, every dorm, and offer the services to enable everyone to vote who can. Thank you.
I can chime in on the evaluation piece. And then I'm sure my colleagues are also conducting evaluations of their programs as well, so I don't always want to be the first one speaking up. But we actually are. So thank you so much for that question, because we get very excited talking about our evaluation. So we're doing a large scale evaluation, rigorous evaluation of all of our reentry programs. That has been ongoing for quite a few years now. And as I mentioned during my presentation, our key outcomes are reduced recidivism and improved well-being. So we're looking at reduced arrest, reduced incarceration stays, reduced convictions. So we have a third-party external evaluator conducting our evaluation. That's kind of an objective way to determine our effectiveness. We have results which should be coming out very soon. We don't have anything that's public just yet, but I am hopeful that we'll have a public finding soon to share with folks. Maybe come back to this type of space to present those. We're hoping that the findings will be promising. There's indicators that it will be on reducing recidivism, particularly for our ICMS program, which was our first program launched in April of 2018. And so we're evaluating our sector program, our DOORS program, and many of our other programs as well. And as I mentioned during the presentation, I presented a little bit about the numbers served through our ICMS and also the numbers that we've served in sector. So just to repeat the sector ones, we have about 1,500 people enrolled. We have trained over 700 people, and we have about 500 people who have been placed in employment.
Thank you for that, Vanessa. Jennifer, you like you're ready to chime in as well. Go ahead.
Of course, everybody asks us about numbers, No, in all seriousness, this is a big focal point for Dr. Wong as our director, that she wants to make sure that we are doing an effective job and that we are really aiming to provide the service that we believe that we are providing, number one, and that she wants to make sure that it's really meeting the community's needs. And so we have a Department of Informatics. We have a lot of different ways that we are trying to use data to not only show effectiveness of current programs, but also look at what are the needs or what are the pieces that are missing in the existing programs that the data is showing us we need to really be addressing, future oriented. A lot of the programs also require us to gather certain types of data and track those things based on the financial sources. So we do have internally by certain programs already measures in place that look at those effectiveness or look at certain aspects of wellness, well-being, criminal justice contacts, and things like that. So it is something that is very present and a large part of not only Director Wong's process, but also it's an emphasis through the RD components of the county at large.
Very good, thank you. And I don't want to leave anyone out. So before we go on to the next question, Jose or Joe, would either of you like to talk about those kind of things, measurables?
Hi, sure. Obviously data is very important. I know the executive level here with the Sheriff's Department, they're about progress and moving forward with all the entities as well as all the programs we have within the department. We do have internal stats and we do keep on top of them again as a measure to ensure that we are progressing forward and to identify issues and areas where we need to dedicate more personnel to and funds if necessary. So we do have staff that collect this data, and we do share it with internally. But yes, it's a great tool, and I appreciate the question.
Hi, Jose, DPSS. So, again, in speaking with our collaborative efforts with the lieutenant and his department, we definitely do keep track of the number of individuals requesting to apply for healthcare coverage upon release. So, so we do that. Um, you know, my chief, Ms. Cheatham, mentioned at the beginning of our presentation that, you know, we've had this long-standing relationship with the Sheriff's Department, and in making every effort to offer our inmate population to have healthcare coverage upon release. And so we've been doing that for quite a long time. I do know, and I can share this, that part of the CalAIM initiative connected with PATH funding, we're looking to expand our efforts in connecting with inmates beyond where we are today. If I dare say, probably, you know, 3 or 4-fold to be able to have in reach within the jail facilities to, again, encourage and facilitate the the provision of healthcare coverage for all inmates upon release. So just to answer the question, we do keep track of our numbers, and we're looking to have those numbers definitely increase once CalAIM is in full effect and once we receive our pending PATH funding. Thank you.
Awesome. Thank you for that, Jose, and all of the panelists. So we have about 10 minutes left for community questions, and we have 6 folks with their hands raised. So we'll go in order: Ronnie, Maria, Anna, Adria, Mark, and then Ophelia. So we're going to shoot for short questions and concise answers. So please go ahead, Ronnie's.
Hi, actually, good afternoon. It's Shireen from Ronnie's house. Thank you so much for your time. I'm actually one of the cohort members under Transforming LA, an initiative that DMH is involved in. And what we did with our funding is we created a platform that aggregated thousands of the resources in LA County, and so that we could deliver those resources in a much more efficient way. My question is, how do we that are working somehow right with DMH and with the county on different levels get to the core table so that we can support some of these amazing solutions and the work that all of you are incredibly passionate about, so that we don't waste this incredible investment that you made in us, and that we can be a part of this work as short as I can. Thank you so much. Good to
And
see
to
you, Ms.
speak for
Martin.
DMH, please provide your contact information to the oversight, and we'll contact you.
Awesome. Very good. We will definitely do that. Okay, and next is Maria Skelton. Please acknowledge the unmute request and go ahead.
Can you hear me?
Yes.
Okay. Well, first of all, I want to say thank you for this meeting, and all your meetings is very informative. My question, to make it quick, so it was said to look on the DMH website about the SALT program. That's one. SALT. Oh, can you spell it? Because I am really only thinking of salt, like seasoning salt. So just a little joke there, as well as what the other caller had said about not knowing about this. Have y'all tried speaking to the community meetings? Example, and I'm using this only Miss Walker. Miss Walker may have a bunch of committee programs that she would someone from your organization that would like to speak. Do y'all go in under a Zoom meeting and would speak to the community? Because I would love for this and all the things that you offer to be out even more, because I deal with reentry people and have a son that's incarcerated right now. So all of this information is extremely great.
So I'm going to answer about SALT. It's SALT, and it stands for
thank you.
Service Area Leadership Team.
Awesome. Wonderful. And we'll follow up. If you can send an email to cocnotify@coc.lacounty.gov, we'll connect you with the panelists, and then they'll be able to let you know on a case-by-case basis on specific events that you're requesting they be involved in. So please email us at the commission, and we'll go ahead and forward it on. And next we have Anna. Anna, I've sent a request for you to unmute. Anna. If you can acknowledge the request to unmute. Okay, seeing no action, we might come back to Anna. We'll go to Andrea Garcia. A request has been sent for you. Please go ahead, Andrea. I see that you're unmuted, Andrea, but we're not hearing you.
Can you hear me?
We
now?
do, yes. Please go ahead.
Perfect. Thank you. Good afternoon. This is Andrea with San Bernardino Freedom All and Project Amiga. And my question is really around the dental health topic and discussion that we were talking about earlier. What we are seeing is a huge disconnection when it comes to services that are being provided. Many of our clients are being suggested to have their teeth extracted for a number of reasons. However, we started seeing about 4.5 years ago that there was a very strong push in that service being offered or suggested. However, there are not many resources to replace those teeth once they are extracted under Denti-Cal, at least to our knowledge. So I was wondering whether or not there are services and how we can connect our clients to those services that specifically are in need, dire need of implants. And again, something that isn't very expensive because what we understand is that is a cosmetic procedure, so that would have to be an out-of-pocket expense, which about 97% of our clients cannot afford. Thank you very much.
Thank you. Does anyone have any insight on that?
I don't have any detailed information for Andrea. She does make a point that if the need for example, a tooth replacement is either cosmetic or medically necessary, that is a determination by Medi-Cal/dental criteria. The best thing I would be able to offer her is their contact information to address that that issue with them when it comes to maybe Medi-Cal dental services providing information or referrals on programs that would facilitate someone getting their teeth replaced that is considered to be cosmetic.
Very good. Thank you for that, Jose. So Andrea, if you can email the email address that's in the chat, cocnotify@coc.lacounty.gov, we'll go ahead and forward that on to Jose. So hopefully he can make that connect. Our next question, second to last question, will come from Mark with Uncle Dave's Housing. Please go ahead, Mark.
Hello, and thank you for this and your time. I've had college courses that were easier to follow than this. It's a maze. So, but anyway, we provide transitional housing. We work with DPSS for the pilot program. I'm wondering, is there more that we can be expanding into? Because I see that there's a lot of different programs. So I'm just wondering if there's more we can do to help with the housing situation. And I have a second question. I think it's for Theone. She mentioned that once a person transitions out of the county program into a third party like FSP, I think the amount of resources the county has and the third party person has are vastly different. Does a third party provider not have access to county resources that the county has? If that makes sense.
So when I talked about people who are referred to managed care, I was referring to managed care typically does not have the access to as many resources as the county. They don't have as many providers as the county does. So that's what I was referencing.
Okay. So they have to get their own providers on their own. They can't utilize what the county has.
If the person is deemed or screened to be mild to moderate and to be better served by the managed care, yes, they would need to have their own provider. Often what happens though is that they circle back and they stay with the county, honestly.
Okay. And then with the housing, like people exiting jails or some of these other programs outside of the pilot program that we do, is there anything else we can do to assist or help?
Sir, if you like, you could provide your information, and we could circle back on that. Maybe have a quick meeting and see about what services you offer, and maybe we can incorporate you into our area here.
Very good.
Okay.
Thank you for that, Joe. So Mark, if you can send an email to cocnotify@coc.lacounty.gov, we'll go ahead and get that email to Joe. And with that, we'll take our last question, which will come from Ophelia Medina. Please go ahead, Ophelia. I see that you're unmuted, Ophelia, but we're not hearing you yet. Ophelia, if you have any other applications like Microsoft Teams or Zoom open, if you can close those applications, and then right next to the mute button, there should be another little caret. You might be able to change which microphone you're using. So if you can try that and speak. We're not hearing you yet, Ophelia. So if you can go ahead and send us an email at cocnotify@coc.lacounty.gov, then we'll forward your question on to the appropriate panelist. And with that, Commissioner Garcia, that does conclude all of our questions from the public.
Thank you to each of our panelists for sharing your thoughts and to the community members for tuning into this important conversation hosted by the Civilian Oversight Commission. I applaud each of your department's efforts towards building a holistic vision of safety and well-being for the most vulnerable. As Danielle mentioned at the beginning, we have one more conference in this series coming up on June 12th to discuss reducing recidivism. We hope you can join us at the upcoming commission meeting at Dollar Hyde Community Center in Compton, set for Thursday, June 15th, and the next community meeting at Florence Library in South Los Angeles on Saturday, June 24th. The commission is also taking applications for a community appointment volunteer. 20 commissioners like me. If you have any interest in this, reach out to learn more. Visit our website, coc.lacounty.gov, for more information and RSVP to our events. Thank you, everyone, and have a great day. This concludes our conference.